day before the conference started, I was out with my friends, had, my normal chicken in my dinner and all. I went to bed, I had a yogurt, all that great stuff. And then when I went through the conference, it just was like a light bulb went off in my brain. Like, oh my gosh, this makes complete sense. This is how, health is, and I've got to make a change in my own life. And the ACLM was there at the conference and got to learn about the organization and was with a whole bunch of like-minded people that were interested in promoting healthy living. And from that day forward, I've been 100% plant-based. If you wake up in the middle of the night, kind of like coughing or choking or making weird breathing noises, if you wake up in the morning and don't feel like you've slept, even though you've been in the bed for 7, 8 hours, 9 hours, don't feel rested, if you feel sleepy in the afternoon, particularly if you're driving, sitting at a stoplight, would you tend to nod off? Would you nod off in a conversation with somebody? Or if you're watching TV quietly, how likely are you to fall asleep? Those are some of the signs, but it can also not have any of those sleep-related things and just be really difficult to treat high blood pressure.
We're here today with Dr. Bryanne Robson. Welcome, Bryanne. Great to have you with us.
Thank you so much.
So Bryanne is a primary care physician at Progressive Health of Delaware. And Bryanne, why don't you tell us a little bit about your background and your credentials that brought you here?
Absolutely. So thank you for having me. And I grew up in Westchester, Pennsylvania, so just around the corner, and went to Connecticut College and studied biology with a concentration in cell and molecular biology. And then from there, I spent 2 years doing research at the Harvard School of Public Health, primarily in infectious pneumonia. And that I used that time to prepare for medical school, take the MCAT, and was accepted to Drexel University College of Medicine in Philadelphia for medical school. Went in thinking I was going to be a forensic pathologist and do autopsies because I was super into crime, and I'm still into that kind of stuff. But I really fell in love with family medicine and the outpatient aspect and kind of maintaining relationships over a number of years, getting to see kids, moms, dads, grandparents, aunts, uncles, and really knowing the whole family story. And so I matched into family medicine residency at Crozier Chester Medical Center, and our primary outpatient location was in Springfield, Pennsylvania. So I did my training there. Then I worked for 3 years at Britton Lake Family Medicine, which was part of the Crozier practice. And in 2018, I joined Progressive Health of Delaware, where I am now.
Awesome. It's a really unique practice, which I think people will get a sense of maybe as we go through talking about it here. And a couple other items I have on my list here that you failed to mention. You were awarded the Behavioral Science Award at Crozier, recognized for your research in domestic and intimate partner violence, and Resident of the Year. Mm-hmm. So it's clearly you weren't just kind of getting by. You obviously really enjoyed it and stood out. So it shows in your practice. So
thank you.
So you're a member of the American College of Lifestyle Medicine, which is relatively new for lots of people. So why don't you give us a bit of an understanding? What does that actually mean?
So it's a wonderful organization that works with physicians, advanced practice providers, and dietitians, psychologists to have a focus on improving people's lifestyles over procedures, drugs, kind of the standard care, and really taking the ownership of your own health through diet, exercise, sleep, healthy relationships, avoiding toxic substances. And I found the ACLM through a conference I went to with the International Conference in Nutrition and Medicine in DC, and was just like, oh, these are the people I'm looking for. This is my tribe. These are great. They want to be healthy from the inside out versus just Band-Aids here and there.
Yeah, it's I've been around this sphere long enough to recognize every physician that I know who's affiliated with ACLM they are truly different in their approach, and it has nothing to do with how long they've been practicing. Some surprisingly late in their practice have shifted gears, and it's like they've been totally re-energized, and it's really fun to see. So I'm just excited that to see ACLM growing in terms of areas within the medical community. I'm guessing they are probably growing faster than any other group within the medical profession.
Agreed.
So what really, when you say you found your tribe, what was there something in your own life that kind of drew you to get more interested perhaps than just following the traditional routes? Or
So I actually stumbled upon the nutrition conference in DC a couple of years ago, and I had been interested in gaining more information on nutrition because I wasn't taught a lot in school, had a little bit in residency, but I thought I'm not really well prepared to counsel my patients when they ask, well, what should I be eating? How should I change my diet? A little less salt, moderation, kind of fudge your way through because you just aren't informed. And the conference in DC, just the little flyer showed up at my door, and I thought, perfect, I'm just going to go see what it is, learn about nutrition, get some credits. And I didn't know it was a plant-based conference, and that was their focus. I had no idea. So probably the day before the conference started, I was out with my friends, had, my normal chicken in my dinner and all. I went to bed, had a yogurt, all that great stuff. And then when I went through the conference, it just was like a light bulb went off in my brain. Like, oh my gosh, this makes complete sense. This is how, health is. And I've got to make a change in my own life. And the ACLM was there at the conference and got to learn about the organization and was with a whole bunch of like-minded people that were interested in promoting healthy living. And from that day forward, I've been 100% plant-based.
Interesting.
It's pretty cool.
As you told me that, I realized a common thing comes up is physicians when they're in medical school, aren't taught about nutrition. And I've always kind of assumed, well, now they are. Well, so you're telling me that even still, we really aren't doing that in medical school.
Correct.
Wow. Mm-hmm. Wow. That's and so that reminds me of something else from one or two doctors have told me who have been at the game for a while, and they said it typically takes about 20 years for practice to catch up with what we already know in science. And I just, it sounds ridiculous, but I keep seeing that as evidence in all sorts of ways, and this is a good one, right? Like nutrition is not a new thing.
No. Certainly not.
This is not some new drug or procedure that somebody just came out with a few years ago, right?
Yeah. Oh, here's some carrots and broccoli.
Yeah, that's interesting. So there's a few things around lifestyle medicine that I think are really important for people to understand. So maybe one of them would be just what a typical visit looks like. So when whether it's a well visit or someone comes in with what might be some minor issue that they don't quite understand. Maybe you can kind of give us a sense of what that is, probably relative to what a regular practice is.
Mm-hmm. So in our office, we're lucky to have longer appointment times, and we've set that up so that we can allow for more lifestyle counseling. And for example, let's take somebody with high blood pressure who comes in for a blood pressure check. We'll repeat the blood pressure after the medical assistant has done it, get an idea of if they're taking any medications, what they're doing, but also dive deeper into what are they eating, are they sleeping well, if they have sleep apnea, are they using their CPAP machine or any sort of dental device, are they exercising, and really tease apart different ways we can make improvements in their lifestyle to improve the blood pressure aside from medication if indicated. And if somebody's interested in those avenues, we can pursue further and set goals and give more direction, give out recipes. But if they're not interested, it won't be aggressively pushed, or, they wouldn't be shunned away from practice. So we do see a number of people who are there for standard medical care with medications and procedures, and that's fine. But where I feel like excel is providing that extra lifestyle counseling. And I think I can give an example of I was at a conference this weekend on cardiology, and there was a lot that was said about lifestyle change. But that was what the phrase was. It was just lifestyle change. There was no further, expansion on what that included.
Yeah.
And I thought, okay, that's their standard medical care. And then there's us where we know what that is and we know how to guide and counsel patients.
Yeah, and that is I think that's a great point, because lifestyle means something different to everybody, right? So you probably get this all the time when you ask them, like, what do you eat? Or, I eat pretty well. Mm-hmm. is a version that everyone answers, which I realize now tells us absolutely nothing.
Oh, zero.
Because we all think we eat pretty well.
Mm-hmm.
And yes, I exercise. Well, what does that really mean, right? So you really do have to get into the details. And the other challenge, again, which you must see is, particularly with I'm sure older patients, we have heard through our lifetime so many different stories and versions of nutrition that a lot of us, I think, I can understand why, have thrown our hands up and said, I just don't believe any of you anymore. Mm-hmm. It's the issue of eggs and egg yolks versus egg whites. What type of cheese, red meat, white meat, fish. Mm-hmm. And it starts to, for a lot of people, I think, they just get really confused, and they've just got frustrated, and so they've given up. So I would think you're one of the few who has the education to help them get back on track and explain. Is that fair?
Mm-hmm.
Yeah. So in that general direction, if we kind of say on high level, where do you find you're trying to direct people, or where are they most receptive, perhaps, would be around food changes or exercise changes? How do you find that barrier? In general, you probably see some common themes.
I would say in general, if I ever mention giving up dairy or cheese, there's usually a mini heart attack that happens. Like, I can't do that. Can't take it away from me. I find that adding foods in instead of taking away tends to be pretty well received. Like, let's add in more vegetables, more whole grains, more fruits, more beans, and hopefully the other things will kind of fall away. And other patterns, so the cheese is huge. That's like everybody's crutch, that and chicken. And I think what also has been helpful is if you give specific examples around certain conditions. So if we'll go back to high blood pressure, that there's a lot of sodium added to chicken. So that's actually a very high salt food where people think, oh, it's a lean meat, it's healthy for me. No, in many ways it's not, especially for high blood pressure. So giving specific examples of why they might not be good choices versus just kind of going on the attack and saying, you're eating chicken, that's bad, you shouldn't do that.
Yeah, that was, sodium was the one I knew. I had high blood pressure a number of years ago. I was exercising 20 hours a week, eating well, but I was traveling a lot, and and it's so hard to avoid sodium when you're traveling, right? It wasn't anything I had much of at home, but even still, it was probably in some things I was eating at the time. And once I got the sodium down, boy, it was easy, but it wasn't obvious to me. So that kind of plays into, I think you touched on it there, particularly with the cheese, is the, I'm of the view that humans are naturally addictive beings. It's not simply the drugs and alcohol that we like to, and smoking that we like to put labels on as the addictions. I think we all have addictions, and foods would certainly fit in that. And when you say something like cheese, right? So the response is the addict's response, right? So it's if you accept that we all have addictions, then at least it allows you to say, okay, well, I'm not perfect, so how can I get through this, or how can I manage it? So the and things like cheese is real, right? And it's all that goes with the cheese, because they're taking, it's probably not one thing; it's a whole, whatever the cheese is on, and what the beverage they're having with it, and it's that whole experience. Have you tried some of the plant-based cheeses?
Well, I'll tell you my secret. I don't actually like cheese in general. So I'm like one of 4 people in the entire United States, I think, that doesn't like cheese.
So that would make it easier.
Yeah, for me,
Yeah.
absolutely. Yeah.
Well, then I'll tell you that we have discovered plant-based cheese, and it is ridiculous. So we've discovered, like at the grocery store, you can get cheese slices that are plant-based.
Really?
And you put them on a burger, plant-based burger or not, and you wouldn't know the difference. So you make grilled cheese. My son likes grilled cheese, so that's how he has those now.
Okay.
And we've learned how to make cheeses at home. Rich Roll's wife put out a great book on this cheese is nuts. And it's easy. If you have a food processor or a blender or something, it is easy to do. And so, yeah, and it's surprising how it's really not about the dairy at all. It's about the flavor that and texture that you experience, and this notion of there can't be a substitute. It is. So there you go. So now you can tell somebody that that would be a good option for them. So in general, maybe around processed foods, kind of where do you see the big villains in processed foods that people come into your office that maybe they don't want to give up?
There are so many. Well, the tricky thing with processed foods is there's so much added salt, oil, other fats, sugar, and that's the stuff that makes your dopamine centers just light up and draws you in, keeps you coming back. Cookies are big. Pretzels are salty, crunchy chips. I hear a lot about crackers and ice cream, big on another dairy. And you don't hear a lot about, oh, I'm so hooked on celery sticks, I just can't get enough. Would be nice. So I think I'm trying to look through the grocery store aisles, but we tend to, candy. There's another one.
Yeah.
That's a tough, yeah.
Interesting.
Very
yeah.
hooked.
And so kind of go back to the dopamine. So what happens when when we eat this stuff?
So there's a response when there's something that's very calorie dense or super sugary, super fatty, that sends a message to your brain saying, this is great, we need more of this. And that goes back to years ago when those were the foods that were really hard to get. And once you got them, you knew that, I had a good number of calories. I could store this for a while. This will be good for my survival. And now when these foods are just so readily available, you get that dopamine hit, you get that your body wants to hold on to these calories and save them. But we don't have these kind of saber-toothed tigers chasing us anymore. And we just walk up to Wawa or the grocery store and you can pick up all kinds of super calorie dense foods versus finding them in the wild and getting a hit of something sweet or fatty every once in a while. Did that answer your question?
Yeah. And so when we think about plant-based foods, we're generally exchanging calorie density with nutrient density, right?
Yes.
And that's typically, they almost never exist together. Maybe something like avocados or a few exceptions, but generally, if it's high in calories, chances are it's low in nutrients.
Yes.
If it's in a foil or plastic wrap, then
in a box, yeah.
Then 100%, yeah.
Yeah, the checkout aisle. Yeah.
And maybe that's the other way to look at it. Does it come in a plastic bag or in a box?
I heard once, and I can't remember who to quote for this, but if it is a plant, it's good. If it came from a plant, it's bad. Meaning a not a store plant, like a factory plant. Right. That's what I mean.
Right.
Yeah.
Right. Yeah. I remember I talked to Dr. Donahue about that. It was I think it was in was it Game Change or something? They referred to the cattle as the middleman, right? And they're another form of a factory or a plant that they're just reprocessing. You are eating plants, but they've been processed, right? Because that's what they live on plants too. They're so it's really not that much different than a factory plant. So when we start to think about more nutrient density foods, I guess generally when you think about trying to educate people, it's around kind of the big picture nutrients, not as opposed to getting into you need more vitamin A, B, C, D versus like kind of tell us a little bit about kind of the kind of coaching around nutrition versus and macronutrients versus micronutrients. Because I would think trying to manage micronutrients, that's a lot more involved, right?
Oh my gosh. Yeah. And one of the things I like to bring to people's attention is we've gone however many hundreds of thousands of years in surviving without paying super incredibly close attention to these different nutrients and calculating them out and following them on apps. You know, we've survived for lots of years without calculating. And I like to bring people's attention to the power plate from Physicians Committee for Responsible Medicine, where there's the 4 different quadrants, and one is legumes, another is whole grains, fruits, and vegetables. And having people focus on getting their foods from those groups, because if you have a very varied plant-based diet, you're automatically going to get enough carbohydrates, protein, and fat, and you'll get way more vitamins and minerals than you ever would have on a meat-based standard American diet, including all of the benefits of fiber, which is really deficient in most people's diets.
Yeah, that's again, that's one of the areas which I think we drive into, and that's if there's one thing I try to raise up as well is it's about the only thing where I've stopped and did a count on how many, right? So the whole kind of cards and counting calories and things with plant-based, like you just don't do it. There's no need, right? You can almost eat as much as you want of plants, provided you still need exercise, but it's there's certainly no need to go hungry or to sacrifice or go without. In terms of recommended protein per day, you have any recommendations you'd give people on that?
I would say on average, about 55 grams of protein a day is more than enough. I would say the caveat to that is if you're trying to build muscle and become a bodybuilder, you would need more. And there's different calculations you can do and different resources to look up for that. But we certainly don't even necessarily, need 100 grams a day for any particular purpose for the average human.
Yeah, and in terms of the our GI system, in terms of the benefits of having that fiber, of just keeping everything moving at a nice, comfortable pace, of again all these other benefits that come with it. So in terms of the benefit of fibers, in terms of from a health standpoint, or what?
Oh my gosh, endless.
Yeah.
So keeping you full, satiated, and reducing your cholesterol, helping pull out fat from your body to help eventually regulate your blood sugar if that's a problem for you, regulating hormones that may circulate in excess, bringing that out, regulating bile.
Yeah, so it really acts like a buffer, right? That kind of pulls a lot of stuff through with it, as both literally and chemically.
Absolutely, yeah.
It is a and it costs nothing.
Right.
It's basically free. So and so I think on average, if I remember the number is, at least on the standard American diet, people are around the 15 grams a day. So it's not hard to double it.
No.
I think I did a quick check, and I'm probably on the 60 range a day, and it's not difficult at all. It's not work. So it's finding foods that are flavorful, that have fiber in them, or adding things like ground flaxseed and things. That's on at least 2 meals a day for me, and chia seeds and stuff.
Oh yeah, I love those.
Yeah, it's easy. So if we think about longevity and what are the leading causes of death, so the simple formula for longevity that we like to use is just defer age-related disease. So the further out we can push those, the more healthy years we're going to live, and likely the longer we're going to live, but more importantly, the more healthy years we're going to live. So if we think about what are the two biggest ones that take, I think combined they probably add up to about 70% of total cause of death, would first be heart disease and cancer. So in terms of lifestyle approach, what would you suggest around impact on, let's talk about heart disease first, in terms of what is, if we wanted to target, if someone already had heart disease or that felt they were at risk, what would be the things you think would be helpful to know?
I would say first start with the diet and transition to a whole food plant-based diet. And if we're talking about heart disease, eliminate, or if somehow it's impossible to eliminate oil, just minimize it as small as possible and go very light on the nuts and seeds and avocados. Increasing dark leafy greens for their nitric oxide benefit is really helpful. And Dr. Esselstyn has a wonderful outline on reversing heart disease with a diet. And then exercise, building your cardiovascular health. So if it's immediately after a cardiovascular event, maybe going through cardiac rehab, like the Ornish program, or even just regular cardiovascular weight training, stretching, yoga. Stress reduction is huge. So again, towards the yoga, the mindfulness, the breathing, making sure you're getting really good sleep. So you may be in the bed for 7, 8 hours, but if you're not sleeping restfully or have undiagnosed, untreated sleep apnea, that's a huge risk for heart disease. And avoiding cigarettes, avoiding excess alcohol, I would say avoid it entirely. Don't do any street drugs. And have a good sense of community and support. And that's probably a harder one to prescribe to people, is, go make friends, go have friends, go get involved. But we do try and work that in.
Yeah,
as well.
And community fits in with longevity too, right? And it's it's hard to prescribe someone. Yeah. Although I do try to, in classes, so here would be some examples of, get involved in a community group or different things, or, surround yourself with people who support you. And if you find you're living in an atmosphere of volatility and friction, then, really looking hard at that, because, and I think that's what I certainly hear every physician, no matter what their specialty is, if you aren't managing stress, that kind of trumps everything. But unfortunately, it's the hardest one to measure.
Yes.
Yeah. So you mentioned sleep apnea. So that's a good one, because people may not know they have it. So what would be the ways to find out if you have sleep apnea?
If you have a bed partner who always has to elbow you or punch you and say, hey, start breathing or stop snoring. If you're sleeping alone, if you wake up in the middle of the night, kind of like coughing or choking or making weird breathing noises. If you wake up in the morning and don't feel like you've slept, even though you've been in the bed for 7, 8 hours, 9 hours, and don't feel rested. If you feel sleepy in the afternoon, particularly if you're driving, sitting at a stoplight, would you tend to nod off? Would you nod off in a conversation with somebody? Or if you're watching TV quietly, how likely are you to fall asleep? Those are some of the signs, but it can also not have any of those sleep-related things and just be really difficult to treat high blood pressure. Or somebody who's on a wonderfully plant-based diet, exercising, and having really low stress, ends up with a heart attack. You're thinking, where did this come from? Sleep apnea can play a role because it's a pro-arrhythmic, meaning irregular heart rhythm, pro-clotting, and pro-inflammatory condition if untreated. So all of those together are really toxic for the body.
Okay. And so is that something where they would go into a sleep lab and get evaluated? That's how I remember it happening in terms of going to a sleep lab many years ago. Is that still the practice to really evaluate?
Most people get evaluated through a home study, and you would go to a sleep center and you would pick up the device for using at home in your own bed. And they tell you how to put it on, and you just sleep that night and then drop it off the next day. And one of the physicians would interpret the data. And sometimes after that, if it's not diagnostic and there's still a high suspicion, you may need to go back and have an in-lab study, which is the typical where you're thinking, somebody just watching you sleep. But I don't think that actually happens.
So the other one, so that was on heart. Oh, and the other one you mentioned around the Ornish program. Mm-hmm. So maybe you want to just tell people what that is.
So Dean Ornish is a doctor out of California and has done really fantastic work on lifestyle in medicine, and I think it'd be fair to call him one of the pioneers or the forefathers of lifestyle medicine. But he has designed programs for cardiac rehab that involve not only exercise, but also guidance on diet, stress reduction, and having a sense of community. So people go through together as a cohort instead of just randomly joining each day. And so this group of, I think, 12 or 15 people moves through the program together multiple times a week for a set number of weeks. And it's covered by Medicare and some other insurance payers. And he's been able to set up different locations through his organization. And there's the closest one to here is in Newark, led by Vinay Hosmani. And I went to visit their location, and it's fantastic. So they have a really wonderful kitchen in there and a good group of people to help the cohorts move along. And so it combines all those different aspects with stress and diet, exercise, and community.
Right, right. And and I'll put a link into that in the bottom on some of these as well. So PCRM will put in. So those are available around the country. So I'll put in the link so people can find one. It's certainly if you're in a larger center, it should be no problem. In a smaller towns, they may not have them, but they also seem to be community based in terms of how they get started.
Right.
So so they're really good at kind of getting that that group going. So we talked about heart health. Cancer is the number 2. I kind of challenge that a little bit because cancer is so many different things. With heart disease, there's really only 3 primarily, and atherosclerosis is number 1 by far. So that one's reasonably close. Cancer, unfortunately, gets spread across the map, and many different strains of cancer. So they all get grouped together, but generally, in terms of if we think about being proactive to prevent cancer, obviously plant-based approach has a big impact there too, right?
Absolutely. And I guess I could say the obvious, not smoking, not drinking, those are huge for cancer. And avoiding processed meat especially. That's a World Health Organization Group 1 carcinogen, just as cigarettes are. So if you think of each piece of bacon you eat is like smoking a cigarette, but for your colon. And the plant-based diet is fantastic for reducing the amount of meat and hormones that are in the meat, especially like in dairy, for breast cancer, prostate cancer. And exercise is also a huge factor for reducing cancer risk.
Yeah, and what we see is a lot of the same things, right?
Yeah.
It's not like there's a different diet.
Right.
They're pretty subtle things, whether you want to look at, well, how many nuts and a few little things like that, but generally it's plants and generally going to be good. Exercise is going to be good. And when we think about, maybe we can talk a little bit about pharmaceuticals. The one that just drives me crazy is all of the ads on TV that we see if we flip it on, as though we could order them through Amazon, which of course we can't. But I think it puts out this notion of, well, everybody else is taking it, maybe that I should too, or this is the latest, greatest. No doubt you have people coming into your office because they saw something on TV last night and thinking they've got the answer if you could just write them a prescription. Does that actually happen?
Absolutely. It does. And what really throws me off is if I've never heard of the medication before or didn't know that this medication was indicated for this condition because they were so quick to put it out to the public before informing the providers of new treatments or new indications for medications. It's pretty embarrassing. So there's also a lot on TV of, do you have XYZ condition? And they kind of list a whole bunch of really generic symptoms, and then people get all stressed out and worried. Do I have this? Do I need to get testing? And, no, let's investigate this, but you might not have this, XYZ scary condition, or you may not need this medication. And it just seems to be like they're selling product versus trying to sell health.
Yeah, and the one that always makes me makes me angry is with diet and exercise. Well, what if you didn't take the drug and did the diet and exercise?
Mm-hmm.
And I think in most cases, you would probably actually do better because you're not going to have the side effects.
Absolutely.
Not in all cases, but if it's always got the caveat of with diet and exercise, that should be a flag to some people.
It should be. Saying,
Right.
what can I do by myself first?
Because if you just take the drug and don't change your diet and don't exercise, the likelihood of having a different outcome in many of these drugs, I assume, is going to be limited at best.
Mm-hmm. And you may need to have the next latest and greatest drug that comes out in the next year or two to add on to your list.
Yeah. And the one to treat the side
Yes.
effect, right?
Mm-hmm.
Yeah. So actually that kind of plays into kind of basic education would be good maybe for people to understand, particularly in the area of pharmaceuticals, which are evaluated by, in terms of, from the way doctors would look at it, would be the number needed to treat versus the number that it causes harm, right? Where it's this balance of, there's nothing that says on 100% of cases it's going to treat it and have no harm.
Mm-hmm.
So there's always this balance that's at play. And from what I've seen, there are a lot of things that, again, diet and exercise from a number needed to treat is low, which is you want that one to be a nice low, and the number needed to harm, short of someone going out and overdoing it, I assume, exercise is generally good for everybody.
Absolutely.
Yeah, and it and that's, I think, the thing the public doesn't see. When a doctor's making a recommendation with any pharmaceutical is that's what they're taking into account, right? Is if I give you this, there's no guarantee.
Am I going to do more harm than good?
Right.
Yeah.
And so that's why the follow-up is so important, because that's part, even though you may not be asking, I'm sure that's what you're looking at is there some other condition here that's one of the side that they may not associate even as a side effect, but there's some other things happening through blood work or something that you would pick up that's, is going to be associated with a drug they were taking or something new, right? Yeah. Numbers of medications, that's another area of, where we see the number of prescriptions. If we go back to the, I can go back to the 70s and look at the number of prescriptions that were given out and to see that change. And certainly in the 90s, I think, is where that really started to take off, and that continues to grow. Why do you think that is? It's just the number of prescriptions that we're taking.
I think that has to do with the fact that people are living a little bit longer with more conditions, and the fact that our diets have gotten progressively worse. So we're, full on into the processed foods, the ones that are giving us the dopamine hits, and those don't tend to lead to positive health outcomes. So I think there's also a play from pharmaceutical companies to make that advertisement and think, I need this medication to thrive and live and be well, and may not. Also taking on too much stress and not dealing with that. And I think we've kind of isolated ourselves more over the years versus in the past, where you would have a lot of people from your family or your community very well involved in your neighborhood. And it seems like we kind of act as little silos where we have our own group and we're managing 1,000 different things that we're doing, but we're not really actually involved. We have these big, giant, social media presences, but we don't have meaningful conversations and interactions with others. And so I think that the loneliness piece, the more mood disorders that can kind of come with, and now I'm feeling sad and maybe I need a medication to help that. And I'm not saying there's anything wrong with needing medication for mood, but I think there's different things that we're doing in our lives, maybe to setting ourselves up for sadness or for eating poorly and then continuing to have worsening health outcomes and going for the candy bar and the easy food because we're so busy shuttling everyone everywhere.
Yeah, as you mentioned there, it wasn't obvious to me, and I'm listening to these things more now, of course, but is the association or certainly the correlations that you see between mood and diet. Mm-hmm. And we know the science supports us, not simply correlations, But anyway, any of us can see the correlation if we see even things like ADHD, right?
Yeah.
And some other things, and we look at the rise with kids in some of those diseases, and realize when we make some changes in diet, we can have significant impacts. Which, if I'm a parent of a child who has ADHD and have been through this, boy, to not have to take any medications and just do some simple diet choices.
Yeah.
Boy, that's great to see. It really says, I think, in a lot of, if you've been through this, is the power of diet is way more powerful than we tend to give it credit for. We associate the power, I think, with what you talk about as the dopamine hit.
Mm-hmm.
But if you step back and say, if I do this change over a matter of just a few weeks, how profound the change can start to be.
Mm-hmm. And how quickly I can start to feel better.
Yeah. And it's like, someone has a diet and they say, well, I feel more energetic, but really start to run that out now over a long period of time. And it's not simply that you lost weight.
Right.
So maybe that's a good one to touch on, is weight loss.
Mm-hmm.
Because we kind of talked a little bit about earlier around counting calories and things. With plant-based, you don't need to count calories. And for people who are struggling with weight loss, how do you coach them around a plant-based diet in terms of what they can do or how to approach it?
I think I tend to poke around and look at their whole situation. So who's buying the food, who's preparing the food, is anyone else in the family eating poorly, and tease some of that stuff out, where their stress is, where their sleep is. Like I'm a broken record. I keep saying the same thing over and over. But I really like to understand what's going on for their weight issue, because it doesn't tend to always just be the food. But if we're just going to dive into the food arena from here, I like to know what their goal is. Are they just wanting to lose 5 pounds? Are they wanting to get back to their high school weight, or what they're looking for? And then I like to kind of give them the full overview that, a whole food plant-based diet is low in calorie density, high in nutrient density, and very easy to follow as a lifestyle versus, this is a diet you're going to do for 3 weeks and then you're going to be done and whatever. And I work closely with Karen at my office, who's a dietitian, and it can be really helpful for patients. But I tend to kind of tease out where I think we could start with some small wins and build momentum from there, and also check in on their expectations, because a lot of people really like to have that, I just want to lose 15 pounds in the first 2 weeks and then I'll feel really ready to do this. Well, that's great. That doesn't always happen with healthy approaches to weight loss.
Yeah, and I think that's, again, I always come at a lot of these things from the longevity viewpoint, and I think one of the most important things for people is to get that into that mindset of, it doesn't matter what you can do in a week or two. It helps you motivationally, but it's where are you going to be a year from now,
Mm-hmm.
right? And the year after, and that's where you see the weight loss programs where they go through the yo-yos, because they're only thinking in a short period of time.
Right.
And that doesn't, yes, you could lose 15 or 20 pounds or 100 pounds.
Mm-hmm.
That may help you in a short time, but that doesn't matter, right?
Right.
If a year from now you have new and worse health outcomes because you didn't sustain it. So the notion of losing weight just for summer's coming up and I want to look good in my bathing suit, or I have a wedding coming up,
Mm-hmm.
While that may get you started, if you don't follow through with something that's sustainable, then I would honestly coach someone, then don't bother.
Right.
Because you're just going to put your body through stress and probably be worse off in a year from now when we're talking. Does that sound fair?
Yeah, and gain your weight back plus a little bit extra.
Yeah, yeah,
Mm-hmm.
and that's and that's, again, as soon as anyone, and maybe that's a good opportunity to talk about diet.
Mm-hmm.
So what is diet? A word that's thrown out there a lot through marketing,
Mm-hmm.
but as a physician, what is diet? Is a definition that you would present to people?
I would say the pattern of eating that you follow. And if we can just jump back a sec, I saw somebody recently who just was telling me how frustrated she was. She lost a lot of weight with keto, which I have my own issues with. But she said it's so hard to sustain. I just can't keep doing it. I just can't keep doing it. And that's what I think is so great about a plant-based diet is it's sustainable. You don't have to think about it. You just do it, and it's easy.
That led beautifully into where I wanted to take you now was when we think about lifestyle medicine and how we practice it, is that it really is truly a team approach. Mm-hmm. So you mentioned Karen Smith in your office as a she's a dietitian or nutritionist, I can't remember which. Dietitian. And then, but that also extends out to specialists as well, right? So you mentioned, for example, like the cardiologist, Dr. Hosmani. Mm-hmm. And the power now of that network of people all talking the same language, mm-hmm. Versus throwing it over the fence, which is kind of how traditionally it happens, right?
Yeah.
So when you refer someone to a specialist, you already know that the type of advice they're going to be giving is consistent with what you're giving, and I assume that you probably would have some conversations with them that would be pretty quickly getting at where are the challenges, and mm-hmm. probably going to be working a lot more effectively together than you would be typically.
Oh, absolutely.
Yeah,
absolutely. It's frustrating working with somebody who says, lower your carbs, increase your protein, where you hear a lot of like bariatric surgery patients come from, and that's tough. So when I refer to the specialists that I know are whole food, plant-based, or on the lifestyle medicine pathway, it's so much easier to manage people with a consistent message.
Good. Coming back to the longevity thing, it also comes back, I think, to that question of numbers of medications, is that one of the trends, unfortunately, we're seeing is early onset of age-related diseases. Right? So we associate a whole number of diseases as age-related, mm-hmm. But what we're also unfortunately seeing is this combination of people are living longer because our doctors are doing a great job of keeping us from dying.
Yeah.
But unfortunately, because of our lifestyle in general and food choices, we're seeing those diseases happen younger and younger. And I assume you're actually seeing that in the office, mm-hmm. of things that you would say can't be yet, but I guess it is.
Yeah, that's fair. So I'm seeing a lot of earlier heart disease, high blood pressure, and especially diabetes.
Yeah, and when you say especially diabetes, so from an age, kind of give me some, shock me.
Shock you? All right. My office manager asked me the other day if I would take on a patient who was 16 and had type 2 diabetes.
Yeah. Yeah, it's and I think the number in the U.S. society now with overweight and obese is now at about 70%. And I remember when we were worried about people being underweight, mm-hmm. with anorexia, and not to belittle that condition, but that's at about 1%, mm-hmm. Of the population. And it's it's inevitable they're all going to end up in your office.
Yeah.
Right. But the good news is these are things that we can actually fix on our own once we start to realize.
Reversible, absolutely.
Yeah. When you go to the grocery store is probably your best pharmacy to spend your time. So as we think about, I'll give you my view of primary care and the direction it's going. It's one of the reasons you're here today, is I absolutely believe we have big change coming in primary care practice. One is the current model isn't particularly sustainable. Mm-hmm. Technology is coming as well. But also the approach of what the primary care physician can do. But what you can do in your office is so much more powerful than what most physicians can do. Mm-hmm. And when you add it all up, it tells me that this is the direction that primary care is going to go, because I know my primary care physicians that I talk to tell me that they're really frustrated. Right? They're frustrated because they don't have the training, mm-hmm. to provide it. They don't mm-hmm. have the resources and network support within their office to do it. They don't know where to start, and they're not funded to do it, mm-hmm. because that's not how their office is set up yet. So I'm sure hopeful, and maybe the other would be on the technology side. Do you touch in on kind of what's coming down the pipe around telehealth and some other ways of getting connected into people in their homes? So I'm thinking particularly here, elderly or infirm clients and things. How do you get some updated health status from them? Is that a place you're touching into yet?
So we have a program in place right now called remote patient monitoring, and that's particularly helpful with blood pressure and blood sugar, where it sends the data to our office and our care managers can review it and review it with the physician if needed. They have a certain threshold of when to involve the providers if there's really abnormal numbers, but it's also giving the patients more awareness of what's happening on a day-to-day basis versus every 3 months coming into the office and blood pressure's high. Oh, it's actually high every day, multiple times a day, or however often they're taking it. I think that technology could help in that sense, continuing to bring in more data from the outpatient, actually in their homes. But I think that telemedicine may be helpful for a number of different things, like just for ease of patients who have different things going on. It may be less helpful in somebody who's like 80 and may have a hard time setting up Skype or whatever, but you never know. And if we're just kind of going back and forth on different medications or they're trying to get some health coaching, you don't necessarily need to be face-to-face, like in person. But then, of course, diagnosing pneumonias and sinus infections is really hard virtually, in my opinion, unless there's, some sort of random ultrasound thing that's in somebody's house. I don't know. But it doesn't seem likely, at least for me right now.
Yeah, my sense is there will be more options coming as we go. But I think you kind of touched on it there, is you'll have more touch points with patients at higher frequency. So you'll be tied into what are the leading indicators of some condition that may be coming. So maybe that's the one you mentioned there, which I think is a good one, is blood pressure. Any reason not to have a blood pressure monitor at home?
I can think of a number of people who would not benefit, primarily because it may increase their anxiety so severely if they have, 132 over 80 versus a 130 over 80. Yeah. Or a person who may be inclined to test it 500 times in a day, and then your number automatically goes up the more times you squeeze your arm. So those patients may not benefit a ton from that kind of interaction, but in general, it's helpful if you're feeling funny, having chest pains or difficulty breathing, feeling lightheaded, just feeling off, to know, what's my blood pressure? But there's also important education that has to be done around how to properly take a blood pressure. You don't do it as soon as you got in from bringing the groceries in and you sit with your legs crossed or you're standing up doing it. So there's a whole lot of education that our staff goes through with patients to get them to do it correctly.
It's one of the things I started doing a few years ago, and I think it's great. And even because the one thing it does do, which you mentioned, was with the white coat syndrome. You didn't mention it, but if you only get it done once or twice a year, in all likelihood, you're going to have some anxiety, and it's probably going to be high, right? Just because, oh boy,
what are they going to tell me now?
What if they discover? And I had one of those a couple of weeks ago, and it was like, I haven't been that high in years. So I know what's going on. I wasn't that high yesterday, and I went and did it a couple of days later and confirmed it was fine. So because we're all, there's some variability with it anyway, so some frequency. But yes, if you're looking to drive yourself crazy, if you're inclined to, maybe not the thing to do.
Right. And I have to say, I love seeing people who are engineers, former or current, because they love data and they love bringing tables and averages and graphs. And I actually really think that's great.
I'll get on my soapbox here for a minute. It communicates that personal responsibility for health. And I don't know when I kind of figured it out. It wasn't nearly as early in life as I would have liked to have thought, but was, even though I'd been affiliated with the medical community, I always had so many people I could look to take care of me. But it's become more apparent as time has marched on that it really is a personal responsibility. If I'm waiting for my doctor, or if I'm waiting for the government or anyone else to tell me that I need to take care of my health differently, that's already too late.
Absolutely.
Your job is not there to be proactive around my health. Your primary job is to cure me from whatever my condition is. Right? That's I know in your practice you go beyond that, but generally that's what doctors are for. They're not there for education and proactive wellness. We weren't raised to think that, right? So that's one of the messages, I think, is what you're trying to do in the education piece, is really proactively help people think about wellness. What does that mean, and how to get there? Because ultimately that's the less they have to come into you,
the better, yeah.
Better, right? You're not looking to get more people in more frequently.
No.
Just to pay the bills. That's not how to pay the bills, right? What's a hot topic and is also becoming a more confusing topic as it gets talked about more is cholesterol, both in terms of coming from food and what's in our blood. So can you kind of give me the education around what I should know about cholesterol, what's important, and what's maybe the misconceptions that people might have?
Sure. So your body naturally, without any input of cholesterol from animal products, will make enough that it needs for your cell membranes, for your hormones, for different functions in the body. And there are very few cases of people who have genetic mutations where this is not the case, but those will be diagnosed when they're young. And you wouldn't necessarily make it to adulthood if you weren't capable of making your own adequate amount of cholesterol. So there's no dietary indication for an excess, adding into that you need to take in through eating meats, dairy, eggs, or fish. And the higher the cholesterol, the higher your risk for heart disease and stroke and all the various cardiovascular, cerebrovascular conditions. And I think that there's a lot of play out there that, cholesterol is not bad for you, it's natural. And yeah, they've done pretty good studies with good data to show that, cholesterol is bad for you, and high LDL is bad, and saturated fat, again, bad for you.
Yeah, and it's want to talk LDL?
Sure.
So LDL, as we were told, was the bad cholesterol, right? HDL is the good cholesterol. LDL is the bad cholesterol. So is that would you agree?
I would agree.
Okay. So if I came back and said total cholesterol, what would be a target if you had to tell anybody a number? Just or is that something you would want to do?
I would say under 150.
Yep. So total cholesterol under 150, LDL
under 70.
Yeah. And so once you're there, your risk of heart disease is going to be significantly lower.
Yes.
Based on what we see, right? So those are and those are generally achievable with diet and exercise.
Absolutely.
Yeah. And then if you can't, and you need some help with it with some medication, but ideally you could start this on your own.
Yes.
Right? Whenever you've had blood panel done, whether it's through work or anything else. One of the organizations you mentioned earlier on was PCRM. Kind of skimmed over that quick, but maybe they're worth a little more attention.
Definitely.
Tell us who they are.
So they're the Physicians Committee for Responsible Medicine, started by Neil Barnard and based out of Washington, D.C. And they advocate for, a healthy lifestyle with plant-based living and do a lot on education for providers as well as the general public. Dr. Barnard goes around and speaks at a number of different organizations and has written fantastic books that I find are easy to read and understand and drive home, I think, simple but effective messages. So it doesn't feel like you're reading this, belaboring textbook and, oh my goodness, it's a enjoyable read, or even on Audible. They're fantastic. But they also make a nutrition guide for clinicians, and in this, you can look up different conditions, and then it'll give you some little nuggets of knowledge about different specific dietary recommendations in, say, for like reflux or kidney disease or osteoporosis. And I think that's really helpful. They also host the International Conference on Nutrition and Medicine, which I mentioned in the beginning, which is where I found out about lifestyle medicine. And it's a wonderful 2 or 3 day conference. I'm blanking on the duration, but a wonderful, wonderful event. And you can go if you're just a general person. You don't have to be a provider.
One area we didn't talk was great food. It kind of goes back to that diet thing. And so how would you describe your excitement around food today relative to when you were eating chicken before you went?
My chicken and yogurt days?
Yeah.
I would say that I eat so much, better, but also the diversity of foods that I eat is just, exponentially larger than what it used to be. And I would say that I've learned actually now how to cook well, and I'm not afraid to try new recipes, and I look forward to all of my meals and look forward to sharing them with different people. And, I made millet. You want to taste what it is? And, it's not just birdseed. It's delicious, and I eat it for breakfast. So I think that food has become more exciting and interesting to me, and also way more colorful on my plate, so it looks prettier. Absolutely. And I was thinking this morning, driving to work, thinking about the talk for today, and how my favorite dish used to be, I'm kind of embarrassed with this, but anyway, chicken and stovetop casserole. So stovetop stuffing with chicken, and then 2 Campbell's soups kind of mixed in, and that was my thing. But I think now I'm just like totally grossed out by it.
Yeah, it's and so I would absolutely echo that. I've never been as excited about food as I am today. Mm-hmm. And I love to eat, and that's always that's not going to go away, right? So I think most of us love to eat, and when we don't love to eat, that's not good, right? That's not a lot of fun for people who have troubles with food in general. But it's I was shocked the more I moved down the plant-based path of just how the whole food opportunity and excitement and flavors literally just exploded. The colors, the flavors. I don't have to worry about burning things anymore.
Yeah.
The things you kind of think about that just go away. I don't have to worry about raw chicken on the counter.
Salmonella, yeah.
And getting that. And I had that, I think, 3 times. And each time, 2 for certain, I was sick for a week after.
Ooh.
And one of them was I was preparing food. We all eat the same food, but I was one who got sick, which told me it happened during the prep phase. And so not having to worry about that. It keeps longer because obviously vegetables, plants keep longer in the fridge. They don't go bad nearly as quickly. So it became much less stressful. The flavors got a lot more intense and diverse, and it has got easier, and it's less expensive. So so on the notion of one of the things we talk about as well is the risk of pesticides in our foods, and this notion of, is it worth the extra to pay organic? And I kind of step back and say, on the big picture, it costs nothing. Like, you shouldn't even really be thinking about it. If you're making good choices, I would argue, get organic wherever you can. And if you can't, that's fine. But as soon as you take away all of the other stuff, your food budget is going to be lower anyway.
So much lower.
Yeah. So if for people who are looking for lower cost solutions and to do meals like for a week, certainly most people, you're not cooking every meal. You probably will do something like, if you're like us, you'll get 2 or 3 meals out of it. So you're cooking less frequently, right?
Yep.
So it's hard to believe, right? It sounds like someone's trying to sell you something.
I know.
We're not selling you anything.
I know. I'm not paid by the carrot industry. That's for sure.
Yeah. So but you have to kind of walk that, I think, to see it. And if you can find someone who is plant-based, and I think it makes it easier because there's a lot to learn.
Yeah.
Right. Because it is different, and doing anything different takes some time. If you had never handled a piece of chicken in your life, and someone put a chicken breast in front of you, there would be a learning curve.
Oh yeah.
And with some probably pretty difficult learnings along the way. So.
And I would add that on a plant-based diet, you can eat your batter when you make cookies or cakes without having to worry about raw eggs.
Right. Yeah. It's and we're seeing the big trend. There's it'll be interesting in 5 years when we have this conversation to see what's happening. But it's as I follow the food industry and the agricultural industry, it's this is not a fad. Mm-mm. This is clearly one of the biggest shifts to come along in probably 30 or 40 years, perhaps. So the pendulum swings, right? In whether it's politics or whatever it is, the pendulum is clearly swinging back to foods that I knew as a kid, because that's just what it was. So I was lucky in the era that I was raised, and we came from a farming community. That's just what you ate. It wasn't because it was healthy. Yeah. That's just what it was.
That was just your food.
Yeah, they hadn't invented TV dinners yet. So it is a challenge if you haven't been exposed to it, right? Which is one of the things which I'm sure in different generations why it'll take some time to see it. I always encourage people, if you have a chance to go visit a farm, go. It's you will be shocked just to kind of see where your food comes from. Food doesn't really come from the grocery store. Right. That's just it came off a truck and sat there. But well, that's great. I think we've touched on lots of areas.
Fantastic. Yeah.
Okay. Well, that's great, Bryanne. I really, really appreciate you taking time to share your knowledge and views and provide some reason for optimism around what people can do and how much influence they have over their own health. So for people locally here, you're at Progressive Health of Delaware, but really there are a number of ACLM offices around the country. So I'll put in some links to help people if they want to find some, whatever state they're in.
Fantastic.
Be able to find that as well. And it's for anyone who's looking for a personal approach to their health, and truly a caring partner. This to me is one of the best things to happen in medicine for some time, and I'm just excited that you're on the leading edge of it, and you will be mentoring a lot of people, I'm sure, over the course of your career.
I hope so.
We're going to come in behind you. So thank you very much, and until next time.
Thank you for having me.
Well, excellent.